Hi, everyone. This is JJ Schuyler. I am the Executive Director of NCIMS, or the North Carolina Integrative Medical Society. And today we have a special guest with us, our speaker who will be at our conference in Asheville on August 13th. And he is Dr. Rob Feeley. Rob is a renowned double board certified addiction and general psychiatrist. He has become an ardent practitioner of both meditation and breathwork over his career, and he is also a teacher of meditation. He has been doing that for over a decade, right, Rob? You've been doing that for a while.
That's right. That's right.
Great. And you've also taught courses at Yale School of Medicine.
Mm-hmm.
And if you want to just go ahead and jump in and tell folks who you are and what you'll be speaking about in August, we would love to hear it.
Yeah, absolutely. And don't mind the wrist brace. I have a little carpal tunnel. I don't think meditation helps too much with that, unfortunately.
Oh, darn.
But thank you for the introduction, JJ. Again, I'm Dr. Rob Feeley, and I'm really looking forward to seeing you all at the conference in August. I'll be talking to you about a very unique and exciting evidence-based program that was recently established called Healing Breaths, which teaches a Sudarshan Kriya breathing practice. And I'll be talking a little bit about why I see this program as the missing link for helping healthcare professionals with burnout and promoting resilience. And so I'm in Calabasas, California, and I've been in private practice for several years. And before being in private practice, I was doing my addiction psychiatry fellowship and residency at Yale. And, you know, when I think back to that time, I think as many of you might remember in your training, it was an incredibly stressful time. And I just remember always being plagued with thoughts of, am I doing good enough? How am I perceived? Did they accept the wrong candidate? I want to do my best. Am I helping people? And I noticed that in the combination of dealing with that stress along with the baby and my wife, that I really needed a surefire way of managing stress. And I was really lucky to have learned this technique, the Sudarshan Kriya, through the Healing Breaths a long time ago. And I found that my personal meditation practice really helped me get through that time. And what I really noticed also was that stress is the thing that not only affected me in so many ways, but also really cripples people. And so I think we must realize by now that meditation is great for reducing stress and valuable for mental health, but how many people can actually get to that state of calm in the initial stage of meditation? I don't know about you, but I know a lot of people that just throw in the towel, and because it's hard to settle the mind, right?
Yeah, they say it all the time. They can't quite get the monkey mind to stop. I've heard people say, the wheels are turning.
Exactly. And so, we're not really taught this at school or at home, really how to manage our mind. And I think what distinguishes this form of this breath-based meditation from other techniques like mindfulness is that it's a breath-based technique, and it's a cyclical rhythmic breathing technique that really, really quickly takes you into meditation. And so that's a really unique aspect of this program. And, I've always had this tool to manage stress, but I noticed that, my patients and my colleagues didn't. And so I felt through time, as I was going through my training and as I sit with patients and as I interact with my colleagues, we're all stressed. I almost felt like, gosh, I have a leg up, and I really feel obliged to sort of talk about this and share the research. And that's really how Healing Breaths was born, which was really to serve healthcare professionals by providing this research-backed tool to help people reduce stress. So that's a little bit about me. And how I got involved initially was, probably it's no surprise, I was really stressed out one day, and I was, a little while ago, maybe 12, 15 years ago, and I was looking for something. And I was like, I need help. No one's helping me, so I need to do it. And so I found this program that teaches the Sudarshan Kriya, and I just, ever since, there's been no looking back, and I've been able to have much more say over my mind. And it's been a really beautiful thing. Just a quick note that the Healing Breaths is a division of the Art of Living Foundation, which is a United Nations non-governmental organization which operates in 150 countries. And, it'll be a real privilege to talk about the research behind the Healing Breaths Sudarshan Kriya program, because While it's been around for a while, we're doing more and more research, and I think I'll just give you a little teaser. One of the most recent studies was done at Yale by a colleague who looked at actually well-being in 131 Yale undergraduate students. And they wanted to compare the Sudarshan Kriya with mindfulness and Yale's own emotional intelligence program, which was adapted from a happiness course they teach there, as well as a control group. And it was so interesting because they found that the Sudarshan Kriya had the greatest effect on the parameters measured, which included aspects of mental health, social connectedness, positive emotions, stress levels, depression, and even mindfulness, if you can believe it, more so than mindfulness-based stress reduction. So there have been over 70 peer-reviewed independent studies that have looked at the Sudarshan Kriya, and I'm just going to put together a package of data for you so that we can all discuss this technique and its uniqueness and its applicability to healthcare professionals. And we'll talk about, its benefits with anxiety and depression and lowering cortisol and even insomnia and life satisfaction. So what you can expect at the course, we kind of talked about that already, but we're going to understand more deeply about the connection between the breath, the mind, and the body through science, but also through experience of very particular profound breath work and meditation, which will come after my presentation.
You just read my mind. I was going to say, we are going to get to sample that a little bit at the conference, right?
Exactly.
Perfect.
So we'll give you a little taste.
Well, we are so excited to have you joining us. As you know, the theme of our conference this year is "The Future is Functional," and I could not think of a better way to kick off that experience in Asheville for the practitioners than to have you speak from the research perspective and then guide us into a session. So very grateful to have you coming and joining us.
Very grateful to be there in person and to also meet you all and connect with you.
Well, thank you so much, Dr. Feeley. We look forward to seeing you in August.
All right, sounds good.
Thank you.
Bye.